Hi there. In light of our bootcamp assignment, which started in the summer of 2020, my colleagues and I did research on the impact of the COVID-19 outbreak on the health and medical sector. You see, the virus outbreak had an impact on nearly all sectors globally, and due to social distancing and health risks, a lot of the sectors went digital. This caused an accelerated digital transformation within most sectors, the health and medical sector included. So, in this video, I'll be providing a brief overview of our research and discuss some of the results. The research was conducted by Isbouts, Pieters, Joris, Wijnen, and myself, Thoby, Visser. A small disclaimer though, this research stretched from September 2020 to November 2020. And since we're still in the middle of the pandemic, it could very well be that the circumstances will change significantly in the near future. So thank you for understanding. For our research, we focused on the digital transformation specifically within the health and medical sector. The health and medical sector consists of businesses that provide medical services, manufacture medical equipment or drugs, or provide medical insurance. The global healthcare market reached a value of about 8 trillion back in 2018 and is expected to grow to 12 trillion by 2022. Compared to other industries, the health and medical sector distinguishes itself by its highly regulated nature. These regulations likely stem from the involvement of vulnerable factors, like life and death. These regulations result in several provisions that apply specifically to the information technology used within the sector. As for the impact of COVID-19, the health and medical professionals have been on the front line ever since the outbreak, due to the rapidly increasing number of health emergencies caused by the virus. The global demand for respiratory equipment grew, prompting the production side of the sector to meet this demand. Nearly all sides of the sector were impacted in some way by the outbreak. Our main objective was to get a better understanding of how COVID-19 has affected the role of IT within the health and medical sector. To achieve this, our researchers focused on digital transformation from three different perspectives. First, we examined the impact on the IT governance of organizations within the sector. With IT governance, we specifically mean the decision rights and accountability framework of IT. Secondly, we view the transformation from a business process integration perspective and highlight some of the changes that have occurred due to the adaptation of new technologies. The third and final perspective is cybersecurity. For cybersecurity, we performed a comprehensive risk analysis on the newly adapted technology called telemedicine. Telemedicine is basically the use of digital technology to remotely manage healthcare, which quickly became the new norm because of the social distancing regulations. These three perspectives will help visualize the impact of the COVID-19 outbreak and contribute to forming a better understanding of the most recent changes. Each of the three perspectives came with their own results and findings. For IT governance, we argued that changing the IT decision jurisdiction towards a more centralized model could help accelerate the adaptation of new technologies and respond to changing environments more rapidly. For business process integration, we highlighted some changes in the business processes and examined several conclusions on adapting this new technology. Finally, for cybersecurity, we analyzed the risks involved with the adaptation of telemedicine, and we also proposed several improvements that will help prevent security risks. We recommend that these suggestions will be handled with high priority, securing the use of telemedicine technology. If you want to learn more about our findings, we highly recommend that you read our research paper. It covers a lot more ground than I was able to summarize in this one video, so it's definitely worth a read. Anyway, I hope I was able to give you a brief overview of what our research has been about, and I thank you very much for listening. All right, bye-bye.